Welcome back to our coronavirus impact special, The New Normal. As businesses slowly start to reopen after being shut down to stop the spread of the coronavirus, customers and employees will see big changes from business as usual.
And some of those changes could stick around for a while. WGAL News 8's Jerry Gish talked to the head of the Harrisburg Regional Chamber about what's next.
What are the biggest challenges right now for businesses as the state starts to reopen?
Finding out what they need to do, and that's almost a business type by business type of business. But the goal is pretty simple: protecting yourself, protecting your employees, and protecting your clients / customers. We're going to be under safety protocols for 6 to possibly 12 months. I don't know how long it's going to take. I know everybody's rushing to get a vaccine done, but as long as it takes, things are going to be different. And some businesses can adapt easier than others, just given the nature of their work. And some, like entertainment venues and things like Hershey Park, it's going to take a little while.
What can customers expect here as they visit more and more businesses as those businesses reopen?
Well, what they're experiencing as they go into the businesses reopening, that's not going to go away. You might have to stand in line a little bit. You're going to have to wear your mask, and businesses can refuse admittance if you don't have a mask. That's their right, and they're trying to keep their people safe as well as other visitors to the source safe. I was in a small business over the weekend that just opened, and they even gave us hand sanitizer before you could walk into the store. So these are the things that we're going to learn to live with, as I said, for the next 6 months to possibly a year.
Are there changes that are happening that will end up being permanent for businesses?
I think some of the things will. The trend has been in office to put people in cubes and put them fairly close together. Now with social distancing, trying to get 6 feet apart, I think you might see either more work from home or an every other day work from home, or something to allow that social distancing in the workforce or in the workplace. And then as things start to evolve, that cube configuration may get a little spread out from what it traditionally was. At the retail level, at the restaurant level, we know there's going to have to be social distancing. I think under the green from the governor, they have to operate at 50% capacity, which is going to be tough for restaurants to do. So there's still going to be a steady takeout business as well as limited seating once we get to green in this part of the state. What we're seeing now in video chat, Zoom meetings, this is going to be very part of the new normal, even after the vaccine, even after the restrictions are lifted. I think Zoom is going to be a permanent part of our lives for some time to come until there's a better platform.
Do you have any feel right now for the amount of businesses that may not come back from this?
You know, that's there's definitely going to be some, and unfortunately, it's probably going to be the smaller of the businesses. The restaurant industry, I've heard from folks in the industry that statewide they anticipate it could be as many as 1,000 restaurants don't make it back. Small retail, you know, they have to pay rent, or maybe they have a building to maintain. They have to pay their employees, and if they're limited, they've been shut down for a long time now. Can they reopen? The question is, can they reopen now? If they get reopened now, and as we were talking about, people feel comfortable coming back, will they come back? And that's going to, the next, I'm going to say 60 days is going to be very telling for a lot of businesses.
Well, it'll be a lot more than wearing masks at your next dentist appointment. See what else to expect coming up.
Plus, ramped up testing.
Only about 15% of the people who are sick with coughs and fevers actually have COVID-19. The rest have something else.
The challenges as we move toward increased testing for COVID-19.